My name is Larry Shulman. I'm a medical oncologist and I'm Deputy Director for Clinical Services of the Abramson Cancer Center. I spend much of my time trying to assure high-quality cancer care at Penn and its affiliated hospitals. This last fall, underwent some surgery at Penn and got to see nursing care at Penn firsthand. Having watched quality nursing care for now almost 4 decades, I can tell you that the nursing care here was really beyond anything I've seen. It's really patient-centered care. They involve the patient in every aspect of the care. When nurses change shift and hand off from one nurse to another, they do that at the patient bedside, again, including the patient as part of the conversation. This is really an exemplary way to provide care, really indicative of how nursing works here at Penn.
I am a nurse at Penn for 18 years. And in November of 2014, I was diagnosed with invasive ductal carcinoma, breast cancer. I had a partial mastectomy on the right side with reconstruction of the right breast and a balancing mastopexy of my left breast. And 2 weeks later was diagnosed with pancreatitis, acute pancreatitis, when I came into the ER with abdominal pain.
I was broadsided by an SUV while riding a motorcycle. I had broken nose, broken neck, but the worst, after they got me stable, was my leg, and they wanted to send me to Pittsburgh to have my leg amputated at the hip. I'm from the Philadelphia area, and my husband and children were like, no, she's got to go to Penn. I was on the trauma floor, and the nurses there really paid attention to talking to each other and to me and to my family members. I think it made it much more efficient, and certainly it was more comfortable for me.
I was admitted to a medicine floor. I guess about a shift and a half had gone by, and the nurses came in and were doing bedside report. They were talking about my history. Well, no time during my history did they mention that I had breast cancer or had just undergone surgery a week and a half prior to this. And when I mentioned to them, hey, what about my breast cancer? They didn't even know that I had had breast cancer. So something that maybe really wasn't very important to my diagnosis, but was, as a nurse and as a patient now, was the most important thing to me, had been overlooked for a whole shift. The fact that these nurses gave report at the bedside allowed me, the patient, to catch something and talk to them about something that was so important to me, and then totally impacted the whole rest of the care that I had while I was in the hospital.
Patient-centered nurse rounding was probably one of the best experiences anybody could have while they're in the hospital, either as a patient or a caregiver, because it allows you to have input into what's going on. Being part of that dialogue was so important because during every hospitalization, I really felt that I had no input into what was going on. This provided me the opportunity to speak up, hear what they had to say, and there was a great amount of interaction between the nursing staff, my wife, and myself during that process.
Being part of the dialogue between the nurses and myself and my family was empowering to me. It helped me be more informed about decisions that I had to make, not only that day, but going forward. The nurses communicated to each other at the end and the beginning of their shift what they should expect and what I should expect. It was just such a big comfort, sort of like a big warm blanket wrapped around you at night or at the beginning of the day.
I think when nurses involve the patient in their care, really patient-centered care, really discuss your situation with you rather than about you outside of the room, it makes everything better. You understand what's going on, they understand what your take is, they understand really what's happening to you, from what medications you're on, to how you're feeling, to what your projected discharge is. And including the patient in all of that work just provides a much higher level, higher quality care.
As a nurse, we get very used to doing things a certain way, and when someone tells us we have to change the way we do it, sometimes there's a lot of pushback from us as nurses. We're like, ugh, Why do we have to do report this way now? It was fine the way we did it before. You know how much time it's going to take us now that we're at the patient's bedside? And now I was a patient and I was realizing why we're doing this. Sometimes things get missed and it's no fault of anybody's. It's just that we have a lot of patients and we have a lot of information in front of us.
You as a patient or a caregiver have the input to provide them with the history of the patient, to make sure they understand the patient, both medically and psychologically, during the process.
Pcnr certainly gave me an experience that I'll never forget. I see the nursing team as a team that really cares. And it's not a 9 to 5 or a 7 to 7. It's a 24-hour job. I had a great experience, in case you didn't know.